Hi, welcome back to Med Rounds. I'm Dr. Tim Moser. Today's discussion is vertigo. Vertigo is a condition that affects mainly adults and can be described as the worst dizziness possible. Persons suffering from vertigo often describe the room spinning around in an uncontrollable fashion, and it's often associated with nausea. Vertigo often strikes out of the blue, oftentimes first thing in the morning when you go to get out of bed. The symptoms may last several days and be completely debilitating for the patient. So to understand vertigo, we need to understand the various parts of the ear. The middle ear is the part of the ear that allows us to hear. And in young children, this is the part of the ear that oftentimes becomes infected. The inner ear is the part of the ear that allows us to have balance. And this is part of what we call the vestibular system. The inner ear is both simple and elegant. Among its parts are three semicircular canals. These are very small canals that are filled with fluid. As we turn our head from side to side or as we roll over, the fluid in these canals sloshes back and forth. The movement of this fluid is connected or measured by nerves that communicate both with the eye and the brain. The information that these nerves provide to these areas allows your body to tell what position you are in and which way your head is moving. Vertigo is caused when a crystal, or what a doctor would call an otolith, which means ear stone, breaks off from somewhere else in the inner ear and finds itself in one of the semicircular canals. Now, as you change head position or as if you roll around, this rolls around on the inside of the semicircular canal. The movement of the otolith within the semicircular canal causes an exaggerated nerve signal to go to your brain and your eyes. The result of this is, with slight head movements or even rolling over, your body gets an exaggerated sense of movement. The nerve in the inner ear sends a very strong signal to your eyes and your brain, telling you that you are rolling around. Your eyes respond by whipping back and forth, trying to keep up with the motion that it thinks that your head is experiencing. The result of this can be debilitating dizziness and also nausea. Oftentimes, people with vertigo have a decrease in their symptoms if they are able to lie perfectly still with their eyes closed for several minutes. The movement in the semicircular canals eventually dies down, and those nerve impulses gradually decrease in intensity. However, the symptoms can come right back if you happen to turn your head or roll over, especially if you're moving in the right direction to activate that semicircular canal. Treatment of vertigo can take on many forms. There's an over-the-counter medication called meclizine that is oftentimes used. Now, meclizine is kind of an old antihistamine medication that is very sedating, but it can also kind of sedate the vestibular system and on the margins help decrease the amount of vertigo that a person experiences. Sometimes prescription medications are needed. Valium is a very effective medication to help reduce the amount of vertigo because it also sedates the vestibular system. Perhaps the most effective treatment for benign positional vertigo are a series of exercises that you can do at home. Now, demonstrating these exercises is beyond the scope of this short video, but if you go to YouTube or Google and enter in the search word vertigo exercises, they can be demonstrated for you. These exercises should be performed several times a day for several days or until your symptoms resolve. Now, vertigo is usually a harmless, self-limiting condition that should resolve after several days, definitely within 2 weeks. If you're having more severe symptoms or you have other symptoms along with the dizziness, it might pay to be evaluated by your doctor. This has been Dr. Tim Moser with Med Rounds, wishing you the best in health and prosperity. Until we meet again, take care.